Hi, I'm Dr. Kiri Brandy, the medical director at the MediSpot St. Lawrence Surgery. And when many of you meet with me in consultation, one of the biggest questions that I get asked is about kind of daily skincare routine and regimen. So I decided to come on here since we're all kind of stuck inside with this COVID-19 stay inside, stay in your house kind of era. I would show you a little bit about what I try to do every morning. I've certainly been better about it now that things are a little bit more not so fast paced with not so many activities going on right now. So what I've already done prior to this video is I love just to kind of clean my face off every morning with this this micellar water. You can get it at various sites. I think even Amazon carries it. Just I like it because then I can put it on like a little pad like this, and then I can kind of just wipe all over my face, including going over my eyes, kind of get all the kind of grime of what I slept in last night. Usually there's some dog kisses on my face and stuff like that. And just kind of go all over. So that kind of gets some of the dirt off. When I am going to wash my face, I love this little gadget. It is the Clarisonic. And what I especially love about it is there's different heads that you can get so that you can change them out. I probably change mine out about every few months. I actually had to go to my daughter's bathroom and steal it because she loves it too. And then you can put a little, my favorite, I have a few favorite face washes. There is one that we sell at the MediSpa by Circadia. And I don't have that out here right now because it's a little bit, it makes your face feel really soft, but it's a little bit oily around my eyes, and especially when I have my eyelashes on, which I don't right now because nobody can do those kinds of things. So my other go-to one, you can get it right at like Walgreens or CVS, is this CeraVe. I love it. It's hydrating. I put a little bit on my hands, kind of go over. This is really nice because it beeps when it tells you to switch different areas. My daughter, this is a very well-used bottle. I had to get it out of her shower, likes the salicylic acid one. It's a little bit better for acne-prone skin. And so once I am done with that, then my face is all clean. You know, you want to kind of pat your face dry. You don't want to do any like abrasive movements on your face. There is a few go-to moisturizers that I use in the wintertime, which is kind of still now. I really like this Weleda. I get this at the Derm Store. I think it's dermstore.com. And I like it. I just, kind of use a little bit, and then you kind of just put it on different, this is going to be too much, portions of your face. Better wipe some of this off. And then you kind of smooth it in. They have a lighter version too. But I use this like in the wintertime and stuff like that when my face is really dry and it needs some extra moisture. And then I always go down onto my neck too, even with the Clarisonic. You don't want to get all those like in between your boob kind of wrinkles. And I smooth it in really nice. But also the thing my daughter steals all the time is this Circadia. It's the Aquaporin. And I like this too. I actually have a different moisturizing kind of thing that I do more like every day, and I'll show you that too. This was just kind of my winter one, and this is my daughter one, and I especially like it for her because teenagers, they waste everything. But if you pump it, see, it gives you just enough to use on your face, and that's kind of really nice to be able to do. And it travels very nicely. It's got a cute little cap, and that's what I love about this one. But the two ones that I use all the time, we do sell at the MediSpa. So I will do this little exfoliating kind of treatment, maybe twice a week, once a week. It depends. And it's like kind of a 3-step process. We call it our milestone package. So first I do this, you leave it on for a few minutes. It's not as abrasive as some of the other exfoliators, and that's what I like about it. And then I put on my 24-hour barrier cream. And it's really nice too because it just like pumps out just a little bit. And then when it's really dry out, which is most of the time, I use the bio serum at the end. So it's a 3-step process and I kind of like that a lot. And then at the end, do not forget your sunscreen. This is actually my husband's because mine's down in the car. I oftentimes put my sunscreen on as I'm getting in the car because that's where I need it the most. But he really likes this a lot because it doesn't really have a scent. Mine is Myriad, the one that I use, but we have one, a really great one from Tuelle and from Circadia at the Medi Spa. And then I really like this a lot. It is like a powder face thing, and you can kind of put it on all over your face, and it's got like an SPF in it. And I like it because it's like a tinter. You know, I don't really wear makeup, as most of you know. I really hate makeup. So this kind of gets it so that I can use a little bit of SPF, like especially if it's worn off and I'm like driving from office to office, and you can kind of put this on. And it's really great. And this is the, I think it's the Color Science. I'll show you the tube. And I feel like I got this at the derm store too. I don't really remember where I got that, but I really like that. All right, well, I will try to show you later this week my nighttime routine, which is a little bit more kind of stepwise approach to how you put on the different kind of creams and serums and retinols and vitamin C's. I will often use vitamin C on my face in the morning. I'm currently out of it, so I'm probably gonna order some from Circadia and have that drop ship so I can get one of those cute kits that Katie did that little video on last time. But vitamin C is usually part of my morning routine also. So hope this helps. Feel free to send us some questions. I'm going to have each one of the estheticians do their kind of little morning skin routine and some of their favorite products, and give us some ideas or questions that you want to hear about. Okay,